I'm going to keep this one short because my car is cold because I went outside. I left it out last night because the kids have their bikes and crap all over our garage. And I came outside this morning. I put all my crap that I carry to and from work for some reason in it, but I didn't turn it on. So it's kind of cold and I don't have a very long commute, so it didn't get very warm. But I have so much crap in my car that you can't see it all. But as I'm driving to work today, the seatbelt warning thing started going off because I have so much of a load of stuff in my passenger seat here that it actually thought there was another passenger that wasn't wearing their seatbelt. So it started warning me, and that's kind of my warning bell that I probably need to tidy up. But today we're going to be talking about common vaccine side effects. And so we're going to talk through the side effects for vaccines because that's a common question and concern that people have. And a little bit of a controversial thing on the interwebs is, vaccine side effects and everything like that. And so I just kind of wanted to discuss what is most common, what we see, what parents call and ask about. Now, I give out a lot of vaccines. In my office, I think I'm one of the highest vaccine giver-outers because I have a lot of young babies. Everybody in our office has a very similar practice, so everybody gives vaccines to essentially everybody that's able to get them. Now, there's some kids that can't receive them, or they just had heart surgery or something like that we take care of when you can't give them, but otherwise we give out a lot of vaccines. And so we have the experience to see when people call after their well visit for their 2-month visit or 4-month or 6-month or 1-year visit, like what are the common things that they're calling about. The most common thing is we don't hear from them because they don't have any issues, or we gave them advance warning they might be fussy or have a fever or something like that, give them some fever reducer, some Tylenol or ibuprofen, something like that, and expect it to quickly pass. So by far the most common thing that we see after vaccine administration is no phone calls, nothing. And what I typically warn parents about when we're giving vaccines is at the injection site, they might have a little bit of redness. That's probably the most common thing that we see and that we get a call about is injection site redness. And that's just because you've injected this thing. It's starting the immune system, like we talked about in the previous video. It's starting the immune system to ramp up. And so when the immune system ramps up, it causes warmth and swelling and more blood flow to the area. And so that's why you get swelling there. And typically what I tell parents if they call, which usually they just kind of massage, use a cool pack or something like that, or ibuprofen. Those are the things I tell them. It's short-lived. It will go away after a day or two at the most. Sometimes they have a little soreness too. I don't hear about it from babies because obviously they can't tell me. But sometimes for teenagers, they'll say their arm is sore for a day or so after a vaccine. And it depends on the vaccine, like tetanus vaccine, HPV vaccine. Those tend to cause a little bit more shoulder pain and muscle pain here for a day or two after the injection. So injection site redness and warmth is the number one thing that people actually call about after not calling at all because there was nothing. Second would be some fussiness or more tiredness. There's been a study that shows that afternoon administration of vaccines causes young babies to sleep longer stretches the following evening. So, maybe that's a sleep strategy for you if you want to make an afternoon appointment. But in general, sometimes a little bit of fatigue or malaise for a day, maybe 24 hours at the most, can happen after vaccines are administered just because your body is responding to the vaccine. And that causes the inflammatory and immunity cascades to start up, and that can just cause some fatigue, some malaise, those sorts of things. So that would be another common thing that we see. Third would be like a fever or fussiness. And usually it's a low-grade fever, and by low-grade I actually mean like an actual fever. 99 isn't a low-grade fever, that's just a normal temperature. But sometimes you'll see 100 or 101. Those are low-grade temperatures in my book. Again, treating that with ibuprofen as a fever reducer or Tylenol, depending on the age and appropriateness for the condition, is the way that parents handle that. And they usually don't call because I warn them, hey, if they're fussy or they have a fever, you can sure give them some Tylenol or ibuprofen as appropriate and expect that things will improve quickly. we usually don't hear about that. Fever lasts for maybe 24 hours off and on, maybe 36 hours, but it's not a prolonged thing. I do tell parents, like, if they get a fever tonight and they were healthy this morning, and we got vaccines, then it's because of the vaccines. But if it's 3 days from now and all of a sudden they were fine and then they're getting a fever, they probably have a new illness that you can watch or be evaluated or whatever is appropriate in the circumstances. So fever or fussiness can be common. Those are the biggest things. I can't really think of any other common things that we see on a regular basis. I've been a pediatrician for 7 years now, and I cannot think of a patient of mine that I've seen that had such a reaction that we said, well, we can't do that anymore. We can't give the other doses of that because it's exceedingly rare to have anything more than that. Now, there's certainly, you can Google vaccine side effects and feel free to, but take it with a grain of salt that there are, of course, rare things that happen that can be linked to vaccines. Guillain-Barré syndrome is a common one that we hear with flu vaccine. And certainly we have to weigh the risk and benefits of everything. And I do that with every patient whenever I talk with them about doing anything other than just maintaining the normal, natural baby that we have. Is this intervention going to cause harm? Is this intervention worth the risk? Does the benefit outweigh the risk? And so we work through that every day, a million times a day, and you've been doing that a lot more now with coronavirus and everything that we have to mentally calculate, is this risk worth the benefit? So that just kind of gives a preview of what our world is like. Well, is this antibiotic worthwhile to give? Well, you have an ear infection, but you're over 6 months of age, and giving an antibiotic can have side effects like rash or diarrhea or vomiting or more serious things. Do we need to do an antibiotic? Well, in some cases we do. In some cases we can say, well, we'll just watch and see, because I like to do as little as possible. And truly that is what I do and talk through with all my patients is, can we do as little as possible? Can we only do things where the benefit far outweighs the risk? And we talk through that all the time. And so I think that is an important conversation to have is there a risk of Guillain-Barré syndrome with flu vaccine? Yes. There's also a risk of Guillain-Barré syndrome with influenza and a bunch of other viruses too. They can cause Guillain-Barré syndrome. So we have to look at the risk-benefit ratio and decide, is the risk of getting influenza and all the other things that can go on when you get influenza is the benefit of vaccinating outweigh the risk, the minute, literally 1 in a million risk of Guillain-Barré syndrome? And so we make that calculation and talk it through and come to a decision as a pediatrician and parent and child when the child's old enough to be involved in the conversation. And then we make those decisions and then we move on, because we can only make the decisions with the information that we have. And we know that there will always be risks. There was a risk of me driving to work today, but the risk of me driving to work is outweighed by the benefit of me having a job, working, taking care of patients, and the risk is mitigated by having a car to drive in that has airbags and wearing my seatbelt and those sorts of things. Is there a risk to sitting in the parking lot right now and not going into my office? Well, my fingers are certainly getting cold because it's 20-something degrees right now, and a car could come by and lose control and run into me, but I think the risk is pretty low of that happening, and so I'm willing to take that risk to write this video or make this video where I'm not going to get interrupted and have screaming kids in the hallways and everything like that. So everything in life is a risk benefit. And so that's what we really have to take into account when we're having this discussion, is that there's no perfect answer, but we're going to do the best we can with the information that we can at the moment or when it's appropriate to make that decision. And I think that's something that everyone has learned even more so in this pandemic, is we have incomplete information. We don't know the future. We don't know with certainty a lot of things, but we can make good decisions based on the information, past experience, experts, opinions, and go from there and do the best that we can. And I really think that that's what everyone is doing and trying to do. And so hopefully this video has been helpful. If you'd comment below with, if this has helped and made sense. If you have another question, comment below, or you can text me. I have a text where you can text parenting questions and things like that, and that inspires these videos. It's 402-256-0768. Comment below. Comment if this has been helpful. Share this, because I think it's important to get this message out of, like, vaccines have side effects. The most common is nothing. The second most common is injection site pain. The third most common is, some fever or fatigue or malaise, and so on, like we discussed. And then this conversation of risk-benefit ratio. I'm sure this is something that you do on a regular basis and you just don't even think it through because it's just natural to you to do a risk-benefit ratio. Well, what's the risk of me getting fast food for dinner? Well, I could get, food poisoning, but on the other hand, like I'm really stressed out and probably would not make a good nutritious meal at home. And so maybe I can just get something that's a little, healthier or something like that. And it gives us time to connect as a family. Well, the risk of getting food poisoning is pretty low compared to the benefit of connecting as a family and having, no dishes tonight and stuff like that. We do this all the time. This is nothing new to us, but it is something that has been brought to light because of this. And I can see that I already went way over my 5-minute plan. And so I'm going to cut this off. Keep up the good work. Comment. Please hit share if this has been helpful to you. Keep up the good work.